So mucus buildup not only harms the lungs, but can also affect other organs such as the pancreas. And in the pancreas, when mucus builds up in this duct, it blocks the pancreatic enzymes from getting into the small intestine, and the pancreatic enzymes are normally responsible for the digestion of fats and proteins. So when these enzymes can't get into the small intestine, these nutrients aren't able to be absorbed and digested. And that's why people with cystic fibrosis often suffer from malnutrition, because their body fails to adequately absorb the nutrients and macromolecules they need. And cystic fibrosis patients often require a high-calorie diet, especially high in protein and fat, because their body doesn't digest these as efficiently. And it can be up to 25 to 50% more calories than an average person of their age, weight, and height. So some of the symptoms of cystic fibrosis involving the respiratory system and lungs include chronic coughing, dry or with mucus and blood, recurring chest colds, wheezing, shortness of breath, and frequent sinus infections. And these are all due to the increased mucus and narrowed lung airways. And cystic fibrosis can also have digestive symptoms including bulky, greasy bowel movements, an inability to gain weight, constant hunger, poor growth, and constipation or intestinal blockage. And these are due to mucus blocking the pancreatic duct. And some of the other symptoms of cystic fibrosis include excessive sweat and salty skin, which are both a result of mutated chloride channels that throw the salt off balance. And some other symptoms are fatigue and an inability to exercise. So some of the complications that cystic fibrosis patients often have to deal with are frequent infections, including pneumonia, bronchitis, and sinus infections, as well as respiratory failure and pneumothorax, which is when one or both of the lungs collapses, shown here, which leads to the formation of an air pocket. And this is really dangerous and requires immediate medical attention in order to treat. So cystic fibrosis can also lead to nutritional deficiencies because of improper digestion. And because cystic fibrosis can clog the pancreatic duct, it can damage the pancreas, which is also responsible for secreting insulin to regulate blood sugar levels. And so that's why cystic fibrosis is often linked to diabetes, because of this connection with the pancreas. And up to 50% of adults with cystic fibrosis develop diabetes. And it can also cause liver disease and failure because the mucus can clog the tube that carries bile from the liver to the small intestine. And it can also result in the cirrhosis of the liver, which is shown here. Basically, the liver tissue becomes very scarred and damaged. Cystic fibrosis can also lead to infertility, particularly in males, where up to 90% of the males with cystic fibrosis are infertile because the mucus can block the sperm canal. And it can also lead to osteoporosis, electrolyte imbalances, and dehydration, as well as mental health problems. So you can test for cystic fibrosis in your child before they are born by prenatal diagnostic tests, which is when a sample of the amniotic fluid or the placenta tissue is tested for the mutated gene. And if these results come back positive, then further testing is done after birth to confirm whether the child actually has cystic fibrosis. And in the United States, all newborns are screened for cystic fibrosis. And this can be done by a genetic test for the mutated CFTR gene or by a blood test to detect for any abnormal pancreas or liver functions, because these are the organs that are primarily affected by cystic fibrosis. Another test is a blood test for immunoreactive trypsinogen, or IRT, which is a compound made by the pancreas. And high levels of IRT can indicate cystic fibrosis, but it can also indicate that someone is a carrier for cystic fibrosis, they had a premature birth, or a stressful delivery. So that's why if results come back positive for an IRT test, further testing should be done, because cystic fibrosis isn't always the cause of high levels of IRT. And the most common test for cystic fibrosis is the sweat chloride test, which checks for elevated chloride levels in the sweat by using a chemical that makes the skin sweat and then applying an electric current. And then the sweat is then collected and analyzed. The average age of diagnosis for cystic fibrosis is within 6 to 8 months, and 2/3 of patients are diagnosed before the age of 1. Because cystic fibrosis is genetic, you're born with it, so the earlier the diagnosis, the better, because it allows for more immediate treatment to take place, because patients who are diagnosed later in their childhood or even in their adulthood will often experience more severe complications. So since there is currently no cure for cystic fibrosis, there are treatments available that can slow down long-term damage, to relieve symptoms, and to reduce the risk of complications. And these include medications such as antibiotics to help fight the frequent infections of patients with cystic fibrosis. There are also mucus thinning medications available, which help patients to cough up the mucus so it can then leave the lungs. And these medications can be taken orally or inhaled. And patients can also receive surgical procedures such as bowel surgery if they have extreme digestive complications, as well as the insertion of a feeding tube, which is what's shown here. And that's to help with if a patient is failing to absorb those necessary nutrients like proteins and fats that they need by just eating them. The feeding tube can help them to get those. And there's also lung transplants available, but unfortunately the waiting list for receiving a lung transplant is very long, so this is not an option for most patients. And patients with cystic fibrosis must learn to do their own therapies daily, and these are airway clearance therapy techniques, which function to loosen the lung mucus so that it can then be cleared. And these techniques also reduce infection and improve breathing. And they include mouth devices, which cause the mucus to vibrate when the patient breathes, which is what's shown here. And there are also therapy vests that use vibration to clear the airways, as shown there. And you can also get a chest clapper, which loosens the mucus. And treatments and improvements in technology have led to survival improvements in cystic fibrosis patients. In fact, the average life expectancy in the 1960s for cystic fibrosis patients was just 6 years old. And now the current life expectancy is 38 years, with some patients even living into their 50s and 60s. And scientists predict that the life expectancy will only continue to increase as our understanding of the disease, as well as improvements in technology, continues to improve.